A lot of news being out there as far as Aaron Rodgers pushing that Achilles injury too aggressively. And while this video is not going to go over all the ins and outs of recovering from an Achilles injury and doing so safely and quickly, it is going to cover one of the most often overlooked aspects of Achilles recovery, or ankle sprain, or any injury really of that matter that involves the lower extremity and requires the use of crutches. The number one thing that Aaron Rodgers is doing currently right now that is in his best interest for long-term development and long-term success with this is utilizing his crutches to help him walk normally and use the foot normally. Too many people rush to get off their crutch and start limping around, walking like a peg leg. If you're doing that, you're failing to understand what the purpose of the crutch is doing. It's providing you an assistance. It's providing you assistance to walk normally. It doesn't mean you need to use the crutch 100%. In some cases where surgeons are not allowing weight bearing, then yes, you need to use the crutch as normal, where you don't put any weight on the affected leg. But in many circumstances, you can start putting a little bit of 10, 15, 20, 35, 45, 50% of your body weight onto that leg progressively in a progressive manner, and utilizing the crutches in a way that helps you walk normally, where you hit the heel, roll through your midfoot, and then off. Think like your foot is like a rocking chair where you're going to hit the heel and roll through your whole entire foot. Do so normally in a gait or a walking manner that does not require you to limp. If you are limping, you are progressing too quickly off of the crutches, and arguably you may not have ever done this in the first place of walking with the crutch to allow yourself to have a normalized gait pattern and use the foot and calf muscles and the Achilles the way it's intended to do so during gait. So when this is allowed by the surgeon, when you are allowed to start putting weight on your foot, this is the number one thing you can do early on after any sort of surgical intervention to foot. This could be for plantar fascia, this could be for ankle sprains, this could be for Achilles ruptures, this could also be for tendinitises that don't involve any sort of rupture or repair. It could simply just mean there's a period of time where you have to unload that limb and do so with a crutch. And this could be one of the most useful ways to help getting you back off a crutch and walking and utilizing your muscles as they're intended to be. So do not discount the benefits of this. This will yield Rodgers a lot of benefit long-term in his recovery process, and you should be doing it too. Do not be in a rush to get off your crutches. Be in a rush to get off the crutches when you can walk normally. Be in a rush to walk normally with crutches. That's where your attention should be focused early on, especially if you have to go through a period of non-weight bearing.